All right, good afternoon, guys. Today I want to talk about the hamstrings, the secondary hip extensors of the body. Well, depending on the angle. Okay, all right, let's go ahead and get into it. So the two tests I'm going to talk about today are the ASLR test, active straight leg raise test, and the AKE, active knee extension test. The two differences between these tests, two differences between these tests is one is for the proximal hamstring, which, like I mentioned earlier, is a secondary hip extensor, sometimes a primary, depending on the biomechanical movement that you're applying. Um, and then the distal hamstring, which is a primary knee flexor. Um, okay, so first, let's talk about the purpose for both of these tests. The purpose of both of these tests is honestly just to measure out flexibility, make sure the client is prepped for exercise before getting him into it. Like I mentioned earlier, the primary muscle is the hamstring. Some bones associated with this are the pelvis and the femur. The joint being evaluated here, if it's the ASLR test, is going to be the knee because it's the knee flexor for the distal. And if it's the AKE test, it's the knee and the hip because, of course, it's extending the hip because the proximal hamstring. Um, what you mostly observe is just a lack of range of motion with this assessment. Um, this will limit how much knee extension the client can do, and it would also perform, the client will have poor range of motion on certain exercise selections such as squats and or deadlifts. Um, Corrective solutions for this could be something as simple as a floor sweep, which is a dynamic warm up, or just a static stretch that involves just holding the test for 30 seconds on both the ASLR and the AKE. Okay, let's go ahead and get into it just so I can show you guys. All right. Um, so first, I had him lift his leg. This is the ASLR test, as you can see, because I'm keeping the leg straight. Um, Particularly with this client, I had a lot of issues with the stretch, mostly induced because one, they haven't been stretched for a long time, but the main factor I had trouble with this client was getting them through the range of motion. The flexibility issue was a big issue. Keeping their knee straight was a big issue through both assessments, which I'll show you the other assessment in a bit. The other issue I had with this client is due to the tight TFL. There was a lot of abduction on the legs, despite me trying to keep a narrow stance, or not a narrow stance, a neutral path of just straight. Um, so let's go ahead and skip ahead a little bit just so I can show you the AKE right here. There you go. There's me doing the AKE assessment. Again, right here, this is another possible thing. I was trying to put pressure here and weight down on this side of the hip because due to the tightness of the hamstrings and the hip extensor of the proximal hamstring, this hip wanted to rise. So that's another issue you gotta look out for when you're performing this test and you're doing static stretches like this. But that'll be all, guys. Have a nice day.